Hello friends, today with the help of these video clips we will understand and see why does Argentina flag sign occur and how to avoid it. Now this is one of the cases in which there was an intumescent cataract, and as you can see the capsule has been stained. The capsulorhexis was started, and just because intraocular lenticular pressure is very high, so any inadvertent pull on the capsule can rip the capsule from any particular quadrant and will result into a situation where the capsulorhexis is compromised. And this is a video in a slow motion which shows what happens to a balloon when it is punctured. So as we can see, a small nick in the balloon which is under pressure will simply rip open. Now how can we avoid that? This was a clip taken from internet, and just to give you an example how this happens. This is one case in which, just to avoid this situation, the double rhexis was performed, and this is one of the methods to avoid having a capsular rip. A double rhexis means that once first a smaller rhexis is created which doesn't go up to very great periphery, so that the capsular rip is avoided, and then attempt is made to drain the intralenticular pressure so that the further enlargement of capsulorhexis doesn't cause any rip in the capsule and tear of the capsule. A smaller rhexis being created, and once this rhexis has been completed, then one can go ahead and use irrigation aspiration cannula or Simcoe cannula, or simply use a cannula to aspirate out the contents of the lens, and the lens material has to be shaken well so that any pockets which are there are also drained out. Once this has been done, the tension on the capsule is reduced, and then we can proceed with a normal size rhexis without the fear of extension. Now I must mention here that capsulorhexis is one of the important part of modern cataract surgery, because an intact capsule and capsulorhexis margin ensures proper centration and retention of intraocular lens in its correct original position where it is intended to be. So it's important to have an intact rhexis so as to have future stability of intraocular lens. The capsulorhexis was attempted on one side, but it was not able to continue, so the surgeon has started from the other end, and the capsulorhexis has been aimed to be about 5.5 mm in size. Now adequate size capsulorhexis has been performed, and now we'll proceed with the phacoemulsification, which will be now just like any routine case. I use a horizontal chop technique, so we bury the tip of the phaco probe into the lens material, and this seems like a fragile, non-leathery intumescent cataract. So rest of the work is not very difficult because these cataracts can be emulsified with ease. It is a pleasure to operate these white cataracts because apart from the surgical ease, the visual gain is phenomenal. The patient has that wow effect which is associated with the phaco, and all these surgeries, because they are being done under topical anesthesia, so the patient has immediate visual gain immediately after the surgery, and that gain is very well appreciated by the patient because of the white cataract, patient was not able to see anything except perception of light and projection of rays, and with the implantation of an appropriate power lens, and clearing of the media, the patient can actually see very well. I have seen that patients can actually see up to 6966 immediately after the surgery once the patient gets adapted to the light. IOL has been implanted and it has directly been lodged into the bag, so we just need to remove the viscoelastic and the surgery will be finished. Thank you.